Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Rudro and in last episode we have discussed the indication of Arjun as a Rudya Dravya. In this Rudrok series, I am taking one point at a time. You may find it the videos are some short or why I am making it so lengthy because we come across the various heart conditions in our clinical practice and we have to interpret these conditions on the basis of Ayurvedic principles. Each condition has its own peculiarity, own diagnosis and a different line of treatment from other condition. Hence, we have seen the infarct where Arjun is contraindicated. We have seen the cardiomegaly where Arjun is indicated. So that's why I am taking the Rudro part by part to understand it very clearly as it is will be helpful in our practice. So next condition which is also common in the clinical practice and which is all of us know is the atherosclerosis. Now what happens in the atherosclerosis? All of us know this is a normal blood vessel and there is accumulation at the inner wall of the blood vessel because of lipids or cholesterol, what you can say, triglycerides, etc. This accumulation starts from there is they increase gradually this accumulation and the lumen of the blood vessels gets reduced. Now in infarct there is a complete blockage of the lumen of the blood vessels and that's why the blood flow stops. Now here there is a gradual accumulation but there is still some space there to flow the blood from this part to the other part of the blood vessel or cardiac or to the heart after this accumulation. So in here you will find many times there is a blockage completely or here you can find there is some space remaining to the blood flow. If this accumulation increases, it is also going to stop the blood flow after occupying complete lumen of the blood vessel. Okay, so what will be the our line of action in this case? This accumulation, all of us know the cholesterol or maybe a sugar or lipids is the main cause. So it is again dosh is kapha dosh and dhatu is the, you can say that it is a because of meda sanchiti. So there is accumulation of such meda sanchay in the lumen of the blood vessel. If when it obstructs total lumen, it will stop the blood flow completely. When there is gradual accumulation, there is at least some chance of the blood to flow to other side, but lumen is reduced definitely. Now, what will be the your thinking about the treatment of this accumulation? Okay. What is the difference between this? This is a completely obstruction, okay, when there is an infarct, and this is the partial occlusion at this stage until it occupies the whole lumen of the blood vessels. Okay. Now, here when there is infarct, you have to penetrate the obstruction of the blood vessels. I have told you that. Now here there is some space when there is not completely occluded lumen. Now you have to reduce this accumulation and hence the karma needed at this condition is lekhana karma, lekhane kharaha. You have to scrap, you have to do the scrapping action in the blood vessels where this accumulation is formed. When you will do the lekhan karma in the blood vessels for this accumulation, this sanchay will be reduced and lumen of the blood vessel will be increase, and automatically obstruction to the blood flow, is also relieved. So what is the difference between these two? That in the infant, you should penetrate the obstruction, because it is completely occluding the lumen. So Bhedan karma is needed. When there is a partial occlusion because of this sanchay, you need a scraping agent in that condition. So here a Bhedan karma is indicated. In this condition, you will require a Lekhan karma. Of course, when if this sanchay of Meda completely occludes the lumen of the blood vessels, again here you will have to perform the Bhedan karma, because unless and until Bhedan is there, blood will not reach to the further area. So complete occlusion, whether it is by thrombus or any other thing, or even by cholesterol or lipid, complete occlusion, Bhedan karma is indicated. And when there is partial occlusion because of such meda sanchay, you will require a scraping agent, and Lekhan karma is indicated. Hope you understand the difference between the two conditions properly. Now we will discuss this Lekhan karma in the case of heart in the next episode. Thank you very much.